Emerald. All right. Look, hello, everybody in Emerald. It's lovely to have you. Thank you very much for joining us. I was feeling a little bit sad that nobody was going to join us from Rockhampton tonight, because normally we get a big crowd down there, but I've had some apologies. I think school holidays is not a great time for everybody, but there is a reason for it being in school holidays, and that's because we've just recently had our students on placement, and Alison, you can remember this when it was your turn, yes, and now so tonight I've got two students and they're both presenting two cases, right? Yeah. Two cases, and then you've got boring old me. So without further ado, I'll introduce Mohammed Al-Materi, and he's going to talk to us first up about blood products, preparation, storage and utilisation. So thank you very much, Mohammed.
Thank you. Good evening, everyone. Today my presentation is going to be talk about blood products preparation and storage utilization. Let's talk about the composition of blood. Blood is highly specialized tissue composed of more than 4,000 different kinds of components. Four of the most important ones are red blood cells, white blood cells, platelets, and plasma. Different blood products can be harvested from single donation of whole blood using differential centrifugation or automated separation devices. Red blood cells. Red blood cells units are the most common blood components used in transfusion medicine. 85 million red blood cells units are transfused each year worldwide. Red blood cells units can be prepared directly from the collection bag that then centrifuged to separate the RBCs from the plasma by passing the whole blood from the collection bag through leukocyte reduction filter, saving platelets into different bag. Or the bag's red blood cells can be then stored for a maximum of 42 days in refrigerator when a proper preservative is utilized. Leukodepletion is the removal of white blood cells from a blood component required to lower the incidence of febrile non-hemolytic transfusion reactions caused by the leukocyte and antigen-antibody reaction, and to avoid the formation of cytokines. Red blood cells frozen is a component that may be frozen for later use under specific circumstances, such as autologous use or very rare units based on their phenotype. The cells must be frozen at -65 degrees within 6 days of collection, if no additive solution added, and RBCs with additive solutions can be frozen at any time before the expiration date. Cryoprotective agent must be used to protect the cells membrane from rupture due to the ice crystals. Glycerol is the most commonly used cryoprotective agent. It's important to freeze samples of plasma or serum for the donor for future testing. The unit can be stored for up to 10 years. Red cell wash. Patients with reactions to transfused plasma proteins, for example, IgA deficiency, and patients with severe allergic reactions of unknown cause required wash red cells. This process can be achieved by adding 0.9% saline to the red blood cells bag and centrifuge the product, removing the majority of plasma proteins, antibodies, and electrolytes. Because the anticoagulant and because the anticoagulant and plasma nutrients are removed from the bag, the expiration date of the product is only 24 hours. CMV negative. CMV seronegative RBCs or platelets may be required for patients who are at risk for severe CMV, such as premature or immunocompromised neonates, and patients of highly immunosuppressive chemotherapy. such as leukemia or lymphoma. The red blood cells units can be divided into 4 bags of equal volume to create red blood cells, pediatric leukocyte depleted. This is to reduce donor exposure for small pediatric transfusion and to minimize product wastage. Fresh frozen plasma. The plasma is the liquid protein of the whole blood that consists of water, electrolytes, clotting factors, and other proteins. Most of which are stable at room temperature. Factor 5 and 8, however, will deteriorate if not stored at minus 18 degrees. Fresh frozen plasma is blood component prepared from whole blood or collected by apheresis and frozen within time limits. Fresh frozen plasma can be prepared from whole blood by centrifugation or sedimentation. The plasma is then pressed out of the first bag into connected bag using plasma expressor. Fresh frozen plasma can be stored for up to 1 year at minus 18 degrees or lower. The storage unit must be equipped with continuous temperature monitoring system. Fresh frozen plasma required thawing period to administration. Microwave or water bath of temperature between 30 to 37 degrees can be used for plasma thawing. Once fresh frozen plasma thawed, it should be transfused immediately. Platelets. Platelets can be prepared from whole blood unit or collected from an apheresis donor. The pooled platelets, normally whole blood donation, contains normal whole blood donation contains small number of platelets which can be separated into platelets concentrate. An adult patient typically requires 4 units of platelets concentrate for a single treatment episode. Pooled platelets units is prepared from a pool of 4 bucket of codes from AB of identical donors and is suspended in additive solution. The volume normally more than 160, not less than 160 ml. Stored at 20 to 20 degrees on platelet agitator for 4 hours if platelets pulled manually, or for 5 days if closed system used, for example SCD, the sterile connecting device. The sterile connecting device is a device used for welding the bags, 2 bags, tubing to each other, so the fluid can pass from one bag to other. Platelets apheresis. Platelets can be collected from the donor using a special device that harvests the platelets from the blood circulation. During platelet donation, whole blood is drawn from one arm into a sterile kit inside a cell separating machine. The machine separates the blood so that only platelets and plasma are collected. The other blood components, red blood cells and white blood cells, are returned to the donor body via other arm. A apheresis machine can harvest different blood products, different blood components. Cryoprecipitate. The cryoprecipitate is a frozen blood product prepared by thawing the fresh frozen plasma bag slowly between 1 to 6 degrees and then centrifuged at 4 degrees. The supernatant plasma is removed into a satellite bag, leaving the precipitate in a small amount of plasma in the original fresh frozen plasma bag. This then immediately frozen, also at 37 degrees for immediate use. The product contains factors 8 and 13, as well as fibrinogen and von Willebrand factor. The storage, once thawed for use at 37 degrees, the cryoprecipitate must be transfused immediately, as factor 8 levels begin to decline within 2 hours. Contraindications. Treatment of hemophilia and von Willebrand factor deficiencies, or deficiencies of factor 13 or fibrinolactin. Fractionated plasma products. The residual plasma products from the process of making cryoprecipitate and some plasma units collected from volunteer donors can be shipped to plasma derivative manufacturer for further manufacture by fractionation into transfusible derivative products, such as albumin, immunoglobulin, and specific coagulation factors. Whole blood. Whole blood. The use of whole blood for transfusion has greatly decreased over the last 30 years, as the ability of repair and store each component separately to maximize its specific therapeutic properties. Fully tested fresh whole blood can be used for neonatal exchange transfusion. Alternatively, whole blood may be reconstituted by combining RBC and plasma to predetermine hematocrit level. Thank you.
Anybody, are you going to go straight on and do your second one straight away, or do you want to interchange?
You can swap in a minute.
Okay.
Well,
Okay, because I was
one
just
or
going to call
is
for
there any questions?
questions at the end. Does anybody have any questions? There's not too many of us, so we can be a little bit informal. How about you guys in Emerald? You're going to sit there really quietly?
No questions.
Is it cold down there?
Yes it is.
I thought it might be. All right then.
This morning,
What? What temperature?
4.
Oh! So you're going to go straight on and do sickle cells now? Okay, so Mohammed's going to continue with sickle cells, and then I'll invite Sarah up to do her too as well. So thank you, Mohammed.
You're welcome. And second presentation will talk about sickle cells anemia. The sickle cell disease affects millions of people worldwide. It's the most common among people whose ancestors come from Africa, Mediterranean countries such as Greece, Turkey, and Italy, the Arabian Peninsula, India, and Spanish-speaking regions in South America, Central America, and parts of the Caribbean. Sickle cell disease is the most common inherited blood disorder in the United States, affecting 70,000 to 80,000 Americans. The disease is estimated to occur in 1 in 500 African Americans and 1 in 1,000 to 1,400 Hispanic Americans. In Australia, sickle cell disease is a very rare condition. Hemoglobin. Hemoglobin is highly specialized intracellular erythrocyte protein responsible for transporting oxygen from lungs to the tissue and facilitating the carbon dioxide from tissue to the lungs. Each molecule of hemoglobin can carry 1.34 ml of oxygen. Hemoglobin is a large tetramer molecule that has molecular weight of 66.7 kilodalton. Hemoglobin consists of 4 protein subunits, typically 2 subunits called alpha globin and 2 subunits called beta globins. Sickle cell anemia is an inherited disorder of hemoglobin synthesis. People who have the disease are born with it. They inherit 2 genes for sickle hemoglobin, 1 from each parent. People who inherit a sickle hemoglobin gene from one parent and a normal gene from the other parent have a condition called sickle cell trait. Sickle cell trait is different than sickle cell anemia. People who have sickle cell trait don't have the disease, like people who have sickle cell anemia. People who have sickle cell trait can pass the sickle hemoglobin gene to their children. Mutations in the hemoglobin beta gene. The hemoglobin beta gene provides instructions for making beta globin. Various versions of beta globin result from different mutations in the hemoglobin beta gene. In particular, hemoglobin beta gene mutation produces an abnormal version of beta globin known as hemoglobin S. Other mutations in the HBB gene lead to additional abnormal versions of beta globin, such as hemoglobin C and hemoglobin E. Hemoglobin beta gene mutation can also result in an unusually low level of beta globin. This abnormality is called beta thalassemia. Signs and symptoms. Signs and symptoms of sickle cell disease usually begins early childhood. Characteristic features of this disorder include a low number of red blood cells, anemia, repeated infection, and periodic episodes of pain. The severity of symptoms varies from person to person. Some people have mild symptoms, while others are frequently hospitalized for more serious complications. The signs and symptoms of sickle cell disease are caused by the sickling of red cells. When red blood cells sickle, they break down prematurely, which can lead to anemia. And anemia can cause shortness of breath, fatigue, and delayed growth and development in children. The rapid breakdown of red blood cells may also cause yellowing of the eyes and skin, which are signs of jaundice. Vaso-occlusive crisis is a painful complication that occurs when sickle cells, which are stiff and inflexible, get stuck in small blood vessels. These episodes deprive tissues and organs of oxygen-rich blood and can lead to organ damage, especially in the lungs, kidneys, spleen, and brains. A particularly serious complication of sickle cell disease is high blood pressure in the blood vessels that supply the lungs, pulmonary hypertension. Pulmonary hypertension occurs in about 1/3 of adults with sickle cell disease and can lead to heart failure. Lab findings. In peripheral blood, normocytic, normochromic anemia is characteristic of the sickle cell anemia. The reticulocytosis from 10 to 20% is typical, as the bone marrow compensate for the destruction of sickle cells by producing more red blood cells. Hemoglobin ranges from 60 to 100 gram per liter. The hematocrit from 0.18 to 0.30 liter per liter. Individuals with heterozygous hemoglobin S have higher leukocytes count than normal individuals, especially children less than 10 years of age. Platelets are also higher. Hemoglobin concentration, reticulocytes count, leukocytes count, and platelets count decrease after the age of 40. Blood smear shows anisocytosis with polychromatophilic macrocytes and poikilocytosis with the presence of sickle cells, target cells, and Howell-Jolly bodies. Nucleated red blood cells can also be present. In bone marrow aspiration shows erythroid hyperplasia. This reflects the attempt of bone marrow to compensate sickle RBCs. Hemoglobin electrophoresis. Electrophoresis on cellulose acetate at pH 8.4 shows different migrations that indicate different hemoglobin types. Hemoglobin A, the most common type of hemoglobin found normally in adults, and hemoglobin F, the type. This type is normally found in fetus and newborn babies. Hemoglobin S, the one present in the sickle cell disease. Other tests. Solubility test. It's a rapid test for detecting hemoglobin S in the heterozygous or homozygous state. The sickle cell solubility test is a qualitative test based on the relative insolubility of hemoglobin S compared to other hemoglobin variants. The positive turbid tube test indicates the presence of hemoglobin S or S sickling hemoglobin, such as hemoglobin C. Metabisulfate test. Metabisulfate test is a screening test for sickle cell's hemoglobin, hemoglobin S. The oxygenation of cell containing hemoglobin S is enhanced by the addition of sodium metabisulfite to the blood, causing sickling visible on the slide. Certain other abnormal hemoglobins, hemoglobin C, Hallam, and hemoglobin I also sickle in this test. Therapy. Many countries with high risk of sickle cell's inheritance have encouraged premarital clinical test programs to prevent the disease occurrence. Other preventing therapy aimed at eliminating condition known as vaso-occlusion crisis in diseased people. In vaso-occlusion crisis, sickle cells have difficulty squeezing through small capillaries, and consequently, the rigid cells tend to aggregate in the microvasculature, increasing vascular stasis. In severe conditions, this may cause tissue necrosis or other complications. Transfusion of packed erythrocyte or whole blood cells can be useful in preventing complications of sickle cell anemia. This therapy is aimed to reduce the formation of a new hemoglobin S. Thank you.
Well done, Mohammed. Thank you very much. Again, I'll ask anybody here in Townsville, have we got any questions? No. Aren't you lucky you've been let off the book? How about the guys in Emerald? Are you going to sit there and freeze?
No, I've got one question.
Oh, there you go.
From memory, is sickle cell anemia, is it related or has an influence in malaria?
Yeah.
Nice question. There you go.
Okay. The sickle cells are. I think I've read about the story yesterday in the World Health Organization about the distribution of malaria and sickle cells worldwide. They found that those countries have high risk of malaria infection. They also have high risk of sickle cell inheritance.
Do you want to speculate on why?
I have no idea, but tried, but yeah.
The malaria is a red cell parasite. Does that help you?
Okay.
So if it can't really fit in one of those
And
sickle
small sickle
Not
cells.
very happy, yeah. So
So
it's protected.
maybe need normal blood cells to occupy it.
That's right.
Yeah.
That's right.
That's it.
Well done. Thanks very much,
Thank you.
Mohammed.